So, namaste all. We are starting with the new disease. Today, we will learn a disease called as Rajekshma. It's in your syllabus. However, the government has now taken a lot of initiatives to eradicate this disease through the modern perspective. However, our perspective of looking at this particular disease is a bit different. Hence, if we try to correlate it to the modern science, then we may not find as many patients of this disease. So let us see what exactly Rajakshma is. So the disease in which there is severe decrease in quantities of dhatus, which leads to multiple symptoms, is called Rajakshma. So the typical feature of this particular disease is there is a decrease or kshaya of all the dhatus in terms of quantity, quality, functionality. So uh, the peculiar feature of this disease is all dhatus, kshaya in all the dhatus is seen. So we have studied diseases in the past and we have seen that there is kshaya of particular dhatu or multiple dhatus. But in disease, we see kshaya in all the diseases. Sorry, in all the dhatus. Okay, so that is Rajakshma. There is kshaya of physical, verbal, and psychological activities in this disease. So, kaik, vachik, manasik. Kaik is physical, related to the kaya, which is the body. Vachik, vacha, verbal, the words, the speech. So, kaik, vachik, and manasik. Manasik is related to the mana or manas, mind, and which is the psychological activities. So, there is kshaya, reduction or decrease in physical activity, the verbal activity, and the psychological activity in this disease. Hence, also it is called as kshaya. The synonym for this particular disease is kshaya. Sorry, Hilary, 1 minute here. I wanted to check if the light is okay. I had reduced one of the lights which was disturbing last time. So if the light is okay, I can continue.
Yes, please. Looks good. Thanks, Dr. Swapnil.
Okay. So hence it is also called as kshaya because there is kshaya of the physical activity of the verbal activity and the psychological activity as well. In fact, there is reduced action of medicine also in this disease. So from the treatment perspective, the action of the medicine also is reduced. Why there is a reduction in the action of the medicine? Any logical answer in this? Any answer? There is reduced action of medicine in this disease. We've not studied this disease yet. We've just started. But any logical answer?
Yes, if the dhatus are already depleted, the medicine won't have a stronger effect because it's already a bit too late.
Okay. Okay, you are near to the answer. Good attempt. So when we say there is depletion or reduction of or kshaya of the dhatus, which means indirectly means there is the dhatu agni of the dhatu of the respective dhatu also has got depleted. Agni mandya at the dhatu agni level, which also means there would be Agni Mandya at the Jatharagni level. And when there is Mandya at the Jatharagni level, and when it is severe, that time the medicine, the action of the medicine also is reduced. Why? Now we know what is the reason, but again the question why? When there is reduction in or depletion of the Jatharagni, then the action of the medicine also is less. Why?
Doesn't digest it?
Correct. So the medicine, when it goes in the body, unless it is digested, absorbed, the action of the medicine won't happen. So, as it is true for any food item, it is true with the medicine as well. That when the medicine goes in the body, the Jatharagni will digest it first and then the action of the medicine will happen. In this disease, Kshaya Rajakshma, the Agni Mandya is to that extent where the action of the medicine also is reduced. So we have limited medicine, or initially we have to start with limited medicine, and as the Dhatu, the Agni improves, Jatharagni improves, and then the Dhatu Agni improves, then we have better options of the medicine. You must have studied this verse, Roga Sarvepi Mande Agno. Roga Sarvepi Mande Agno is the Sanskrit verse, which means that most of the disease, in fact, in the literal meaning of the verse is all the diseases which happen, the samprapti of that goes through Agni Mandya. So every disease goes through this phase of Agni Mandya. In fact, the pathogenesis, the samprapti starts with Agni Mandya, is what this verse says. So we have to understand that most of the diseases which are formed in the body have Agni Mandya as one of the uh, hetus, or one of the steps in the process of disease formation. Okay, so in that, the digestion, we know the definition of swasthya, or the healthy person. What is the definition of swasthya? Anybody knows the verse? Anyway, let me say it. Samadosha samagnischa samadhatu malakriya prasanna atma indriyamana swastha ityabhidhiyate. That is the Sanskrit verse for swasthya. So what it means is samadosha, equilibrium in the doshas. Samadosha samadhatu. Samadosha samagnischa. Sama Agni. The Agni is properly lit. So your Jatar Agni, the Dhatu Agnis are working well. So when there is equilibrium in the dosha, the Agni is working properly, the Dhatu formation is happening properly, Malakriya, the excretion of the waste products is also happening properly. Then what is the resultant? Prasanna Atma Indriya Mana. All these are in the state, pleasant state, okay, in the happy state. Prasanna Atma Indriya Mana. The soul is happy, the Indriya, the sensory organs, and the Ekadasha Indriya, we say. So 5 sensory organs, and we have 5 uh, external organs, which and the mind, Ekadasha Indriya, they are in the state of equilibrium, in the happy state. Is the swasthya, the definition of swasthya. Now here, understand the importance of Agni. When the Agni is lit properly, the functioning of digestion, then absorption, excretion, etc. is happening properly. That is leading to health. And when there is any disequilibrium, Agni-mandya, then it can lead to various signs, symptoms, and up to the disease formation level. So here there is reduced action of medicine because of the severe depletion in the Chatur Agni as well as the Dhatu Agni. Here, more importantly, the Dhatu Agni. Okay. Majorly, Rasavaha and Pranavaha Srotas Dushti. Here, multiple Srotases are in fact vitiated. Majorly, when we see the signs and symptoms, we see of Rasavaha and Pranavaha Srotas Dushti. Okay. So what are the types of Rajashma? Causative factor based. So based on various things or the various parameters which are applied the criteria, we see different types. Causative factor based on the hetu. Vegavarodha janya. Okay, Vegavarodha Kshayaja Sahasaja Vishamashana janya. Okay, so as we see in the future slides, we'll understand what is the literal meaning of this. However, when you understand or when you hear the word, you would get to know some part of the meaning. Vegavarodhjanya, holding of natural urges. Kshayaja, depletion of something. What we'll see. Sahasaja, uh, attempting something which is beyond one's physical capacity. Vishamashana janya. So Vishamashana, ashana related to food. Then according to the Samprapti, based on the Samprapti, Anuloma and Pratiloma. So there is a Anuloma Samprapti, there is a Pratiloma Samprapti also. Anuloma is in the direction of the natural direction, and Pratiloma is against the natural direction. Based on Rupa, Rupa is the presenting symptom. So three Rupa, three major symptoms are seen. Shad Rupa, six major symptoms are seen. Ekadasha Rupa, 11 major symptoms are seen. So based on, there are three criteria: causative factor based, Samprapti based, and Rupa based. We'll see the details in the further slides. So what are the hetus? Vegavar, according to the types, the hetus vary. Vegavarodhaja, holding of natural urges, especially flatus, mutra, and purisha. So we understand that it is related to which type of vayu? Vata has 5 subtypes.
Apana
Yes,
Vayu.
correct. So Apana Vayu is majorly affected here. So when there is holding of natural urges, especially of Apana Vayu, flatus, mutra, purisha. So I have said this in the past as well. Will your body or will the body show major signs and symptoms or disease formation stage if you hold the natural urge once or twice? No. If it shows a concern, it would be temporary and it would subside when that urge is released. Okay, so whatever effect is shown, that would be temporary. But if that particular activity or action is done on a regular basis, then the body will start showing various effects on the body. I mean, the disequilibrium will be seen at a larger extent, and the pathogenesis, the formation of the disease, will go to the next stage when it is done on a regular basis. Once, if suppose the urge to pass syphilis or purish is held for a long time, then pain in the stomach or difficulty in breathing or headache, discomfort in the abdomen, pain in the anal region will be seen. And when that is the urge is released, most of the issues will subside immediately and few will settle after a while. Okay, so when there is causative factor or hetu, exposure to that particular hetu once or twice will show symptoms, if at all it does, will show symptom which will be temporary for a shorter duration. And when that particular exposure or hetu 7 is reduced, the issue or the concern which the body has shown as a reaction will subside on its own or after some time. If you have done a lifestyle change opposite to the concern or a food item which is opposite to the concern, then it will subside immediately or over some time. So, holding of natural urges, especially flatus mutra purisha, is one of the strong causative factors for Vegavarodha Ja or Vegavarodha Janya Rajekshma. Ruksha Ahara by Krusha patient. So the patient is already Krusha. Krusha means cachexic or emaciated or thin, not very fat. So Ruksha Ahara by Krusha patient, eating less or no food, overthinking, grief, emotional disturbance, etc., overbleeding or chronic debilitating disease. Now here we are seeing the Hetu or causative factor for Kshayaja. If you see in the slide, the second point, Kshayaja. So here the Kshaya or depletion of the dhatus is happening on a larger scale, right? So how it is happening? The patient is already thin, not very fat, and consuming ruksha ahara. What it will lead to? It will lead to more of vata prakopa, dryness. So eating less or no food, fasting. We have seen this in Karsha, if you remember, the causative factors in the disease in Karsha similar, that the patient is already thin and excessive vata aggravating hetus are consumed. Even in Sthaulya, what was the name of the disease? Sthaulya is the Sanskrit word, but anyway, so in which is we are targeting weight loss. So in that weight loss, when we do something which is lekhana, which is khara, which is trying to deplete the fat tissue, there in that particular disease, Sthaulya, we have to ensure that uh, the lekhana does not happen to an extent where vata prakopa would happen. That is similar in even in Udvartana. So we are trying to do something which is trying to balance kapha, but we should not do to an extent where the vata will get aggravated. So when that happens to a serious extent, then it will lead to dhatu kshaya, is what we saw. So similar samprapti happens in Karasha as well. So eating less or no food. Langhana. We see Langhana, Pachana as the line of treatment in many diseases. So we keep saying this, that when you ask the patient to do Langhana, do fasting without food uh, for a shorter duration, with Ushna Jala, Ushnodaka, consumption of Ushnodak first, and then uh, shifting the patient to Laghu Ahar, lighter to digest food, so that there is no Vata Prakopa. Okay, so what we are doing is, initially we are trying to uh, ignite the Agni, ignite the Jathar Agni, and so that the action of the medicine also happens faster, and whatever is consumed gets properly digested, absorbed, and goes to the next level. So when we say that fasting or langhana should be done, langhana is of two types. One is with food and without food. So without food, initially we do in order to ignite the digestive fire, so that it becomes stronger, and then we shift the patient to laghu ahara. Okay, so that is also langhana with laghu ahara. So that should be done to an extent where the vata prakopa doesn't happen. Okay, now in that case, when we are doing langhana in the treatment, as a line of treatment in various diseases, the vata prakopa, even if it happens, may not go to an extent of rajekshma, because we will cut the process somewhere in the middle or in the initial stages itself, so that it doesn't go to the next level, because we will see the patient will start showing various signs and symptoms of vata prakopa, and we will immediately try to settle it down. Hence, that may not go to an extent of rajekshma. However, when we say, so the point here I'm trying to make is, when we say langhana or laghu ahara, fasting, upavasa, in the initial stages of treatment of any particular disease where it says langhana and pachana, it should be controlled. You should have a particular or you should keep an eye on what is happening with the patient, how the signs and symptoms are subsiding, how the patient is feeling. Is the patient feeling lighter now? Are the medicines acting properly? So there would be various signs and symptoms, or various things which the patient would show, which will make you realize that okay, the patient is recovering. Okay, so that recovery phase needs to be examined properly in the initial stage. Once the Jatharagni is properly ignited, the doshas are settling, then you may not be required to keep an eye on, or supervise the patient, observe the patient uh, meticulously. But in the initial stages, yes, you can tell the patient that you may call me every day, you may call me after every 2 days, so that the development or the recovery is properly observed. Now, what happens is, sometimes, most of the times, in fact, if the patient, now we have a clinic in a residential society, where close to a residential society, I should say. So we get patients from nearby houses. So the patient is 100 meters away, 50 meters away from the clinic. So we give 7 days medicines, and the patient, even if the patient has some concern, may come on the third day, second day, or on the fifth day also in between, because they are in the close vicinity. But if the patient is from a far distance, say 50 kilometers, 100 kilometers, 200 kilometers, the patient may not be visiting so often. So, uh, because they are at a far further distance, we give medicines for say 15 days and we ask the patient to come after 15 days or a month. But if we forget to tell the patient that if you have any concerns in between, you may call me anytime, the patient would keep consuming the medicines, will keep consuming or following the dietary rules and regulations which you have told, and the patient may, because you have told certain things to do, he or she will keep doing those things for 7 days or 15 days or 30 days, whatever number of days medicines you have given. If there is recovery, it is good. If there is no recovery, then the patient will keep assuming that this is how it happens and will keep following the same things and will keep bearing the problems uh, without even realizing that we can get in touch with the doctor, or this is how usually it happens, this must be a part of the recovery, this must be happening due to the medicine and this must be the natural process. So the patient assumes that okay, this is how it has to be ideally and hence it is happening to me. So when you are treating the patient, you have to tell the patient, understand from how far they have come, or how serious the problem is, and based on that you have to tell the patient that either if they come from close vicinity, give medicines for 5 days or 7 days and ask them to follow. If they are from a further distance, tell them, understand what the concern is, and based on that, you have to tell the patient, okay, you can call me or get in touch with me through phone call or Zoom call or video call or whatever is convenient. So that if there is some reaction of the body, or I mean, when I say reaction, the body will react to every medicine which is in a positive or negative way. So if it is happening in the positive way, then no problem. But if it is reacting uh, differently than what you expect, because if you have not been able to understand the level of dosha, the extent of uh, the dosha in the body, or extent of uh, the concern, so it may be related to dosha, dhatu, or mala, the severity of the problem. If you are not able to diagnose that and you give a certain, or the patient is too mild and or the problem is too mild and you have given a stronger medicine, because you have seen the patient for the first time, you may not be able to gauge the koshtha of the patient, wherein it may be very sensitive. So if the koshtha is very sensitive, you give a bit of stronger medicine or even medium strength medicine, the body may react with chardi or atisar. Atisar mean not atisar as a disease, but loose motions. So the patient may assume that okay, this is how it happens. So vomiting may happen. Oh, doshas are going out. Yeah, the doctor had said that with the medicines, the doshas will go out of the body. So maybe chardi is happening or vomiting is happening because as a part of the treatment, loose motions are happening as a part of the treatment. So which you may not be expecting. Okay, so if you expect that the motion should be clear, is your expectation. So the medicine which you have given, for example, Gandharva Haritaki, you have given Gandharva Haritaki for mild purgation. Okay, Mrudu Virechan. But the koshtha of that particular patient is too sensitive, and the stimulation, she is not able to take the stimulation given to the excretory system, and the resultant is loose motions. So one loose motion is okay, because the doshas are going out, the malas, excess malas, or the accumulated malas are going out. But if there are 2, 3, 4, 5 loose motions in a day, 6 loose motions in a day, the patient, if keeps assuming that it is a part of the treatment, may end up in a different problem than what the primary concern was. Okay, so uh, here what I'm trying to tell you is, uh, when you give the medicine, make sure that you tell the patient to get in touch whenever there is something different which happens. Okay, so when you plan the medicine, you know what kind of action that particular medicine is going to do. So we usually tell the patient that, okay, if we have given a purgative medicine, that there would be 2 loose motions in a day. So do not worry. And of course, there are other, on the other side of the spectrum, you would see patients who are uh, overly concerned. So with one loose motion also they will call, oh doctor, I had loose motion and there was a lot of water which went out and I'm feeling tired and exhausted. So you have to then tell the patient that, okay, that was a part of the treatment medicine. Do not worry at all. Had you told this in the consultation itself that we have given medicine which will help you pass the motion clearly, and if at all there is a loose motion, 1 or 2, do not worry. If it is beyond 2, then you may call me. And during the follow-up, when we ask the patient, uh, did you have clear motion? Did you have loose motion? Oh yeah, I had loose motion. 2 loose motions almost of us 3-4 days. Then after that, it settled down. So what happened? In that case, the patient did experience loose motion, but felt better because you had already prepared the mind of the patient that this is going to be the course of action of the medicine. So when you know that this is going to be the course of action, you have given a medicine which may induce sweating. Jwara is there and you have given something which is going to induce sweating. If you have prepared the mind of the patient, then when they see the action, they understand, okay, the medicine is working properly, one, and I'm feeling better. So this is a part of the treatment protocol or the action of the medicine. Okay, and when you say that there is going to be, or you may experience loose motion or 1 or 2, please use the word may. It does not compulsory that everybody will react in a particular way as you are expecting. Okay, so you may experience. It's not that you will experience. If you say you will experience, and if they do not have 1 or 2 or 3 loose motions, they will call you and say, doctor, the medicine is not acting. I think you have given a medicine which is not very strong. Can you give stronger medicine? So our intention is not purgation or a particular action. Our intention is to settle the problem. Okay, so when you use the words to the patient, use them wisely so that there is no confusion, there is no over expectation, or there is no magic which is expected. Okay, so use your words very wisely, controlled, limited, and to the point. After saying, if you realize that, okay, I think I have oversaid something, you correct yourself in front of the patient itself. Doesn't matter. But if you give them over expectations and there is something less which happens, then uh, they unnecessarily they may feel that there is the wrong medicine has been given, it is not working properly in my case, the practitioner is not good, let us find somebody else. Okay, however, that was not the case. It is just the words, the gap in saying and understanding was there, hence this particular thing happened. So even if the patient is feeling good, but what they have kept in mind is your words, you may feel or you will feel or you will experience say 1 or 2 loose motions, you will sweat, or you will feel light after you have consumed the medicine, etc. So medicine is medicine, and it has a particular action which you are expecting it to do. However, every body is different. Okay, every person has a different prakriti. So if you are not able to gauge the prakriti, the avastha of the disease, the stage of the disease, the severity, intensity of the problem, do not oversay, so that you set uh, limited expectation. If they feel more than what you are uh, saying or committing, it is good. But if it is less than what your words were, then they may start questioning uh, the medicine, the science, and you as a practitioner. Okay, coming back to our topic. So, eating less or no food is upavas or langhana. So, that is over langhana, overthinking, grief, emotional disturbance, etc. So, this is also going to deplete the which dhatu? Overthinking, grief, emotional disturbance is going to deplete
Rasa.
rasa dhatu. Very good. So, and when the depletion of a particular dhatu starts, the effect of uh, that is seen on the next or the following dhatu as well. So when we say this is a disease of rasa dhatu, does not mean that it will not affect rakta dhatu. Yes, the symptoms of rakta dhatu also will be seen. Few symptoms of the meda dhatu also will be seen. Mamsa dhatu also will be seen. Asti dhatu also will be seen. The following dhatu, uh, some symptoms or signs will be seen of the effect. So we also understand how with particular symptom we will understand that the involvement of the next dhatu or next to next dhatu also has got uh, disturbed or involved. So the the disease is going to the next stages and needs faster treatment and relief. Overthinking, grief, emotional disturbance, etc. Overbleeding or chronic debilitating disease. Overbleeding is severe loss of rakta dhatu or chronic debilitating disease. So a disease in which there is kshaya of the dhatus, and the patient or the disease is untreated for a long time, will end up in Rajakshma ultimately. Because say suppose an example, there is a disease of rasa dhatu. Okay, think of any disease which is related to rasa dhatu, and if that is not treated for some time, then it will show symptoms of rakta dhatu vitiation or depletion also. Further, if it is not treated properly or uh, not treated at all, then it will go to the next dhatu. So the effect of the next dhatu is going to be seen in the signs and symptoms, and then you understand and realize that it is now no more the disease only related to rasa dhatu. The next dhatus, following dhatus also have got involved, and it may go up to the shukra dhatu also. So when it involves shukra dhatu, then the main disease, primary disease, uh, may be present as a disease, but the entire body now is gone into the kshaya stage or the rajakshma stage, that you have to understand. So the involvement of all the seven dhatus is kshaya or rajakshma. Chronic debilitating diseases, when not treated for a longer time, will end up in Rajakshma. This is the Ayurveda perspective. When we say Rajakshma, and I said that the government is taking a lot of measures, this can be correlated to tuberculosis, TB. Okay, tuberculosis. And we know that governments of many countries are taking a lot of precautions, and a lot of arrangements are being done to eradicate that disease. But here we are looking at that particular condition from Ayurveda perspective. So uh, we are relating it to the kshaya, depletion of dhatus in the body. Okay. Sahasaja. Sahasaja Rajashma, what is the hetu? Physical exertion more than the capacity. Okay, so doing something which is more than the physical capacity for a longer time and on a continued basis. Okay, so physical exertion more than the capacity can cause internal damage to the chest region. Okay, so uh, when there is excess physical exertion, it will lead to exertion on two major organs. Okay, when there is excess physical exertion beyond the capacity, which are the two organs importantly which are strained heavily? When there is excess physical exertion beyond capacity, two organs which are strained more than the capacity. Yes, somebody said
The heart.
heart and
The lungs?
yes, very good. Heart and the lungs. Very logical, very logical. Heart and the lungs. More oxygen is required, excess breathing is required because the supply of oxygen to the muscle is required. And it is who carries the oxygen to the muscles? It is the blood. From where does the blood come? From the heart. So it is pumped by the heart. So excess work basically is done by the heart and the lungs. Where are they located? In the ura, chest region. So can cause internal damage to the chest region is urakshata. Urakshata, internal trauma to the ura or the chest region is urakshata. Hence it is said can cause internal damage to the chest region. Urakshata. So we understand why it is the chest region, internal damage. Sahasaja, Rajakshma. Whatever is the physical capacity, beyond that, if something is done on a regular basis. I had given this example of people exercising regularly. So I had also given this example where somebody is lifting, say, 2 kg weight today, does 2 kg for some time, then goes to 3 kg, then goes to 4 kg, 5, 10, 20, 50, whatever. They are slowly increasing the capacity of the body. In doing that, the internal nourishment which will support that growth or support that capacity, increase in capacity, should be maintained properly so that the dhatus don't into the phase of kshaya. Over usage of a particular dhatu is going to be leading to depletion if there is not support system in place. Okay, so mounts dhatu, when you do exercise, heavy exercise, and if it is not supported with nourishing internal as well as external nourishing elements, it will enter into kshaya. Okay, Rasadhatu, Raktadhatu, Mamsadhatu will enter into Kshaya if they are not properly nourished when this capacity increasing is happening. So, you would see a lot of sports people, they have their dietitians, they have their doctors who are checking their vitals on a regular basis and also giving them a particular food regimen. Why there is a particular food regimen? Because they have to ensure that certain elements have to go into the body in order to support the overusage of a particular body part or the body parts. Okay, so now through the Ayurveda perspective, nourishment to the particular dhatus should be kept in check in order to support. Now, when will this particular thing come into play? When somebody comes to you only for consultation, lifestyle consultation. I do not have any problem, but I have come to you for consultation because I have heard that Ayurveda has a lot to offer in order to maintain health. So the person comes to you just to do consultation and understand how they can improve their lifestyle and maintain their health. Okay, so in that case, when you check everything, their profession, their daily routine, their lifestyle, their food habits, etc., etc., small corrections according to their profession should be told. So if they are physically active, they are sports people, or they do some exercise, then support system has to be kept in check properly. Okay, else not every patient who has excess physical activity will end up in Sahasaja Rajakshma, but that person may end up into Sahasajanya Rajakshma if they are not supporting their excess physical exertion. Understood? Fair. So, Vishamashana Janya Rajakshma. In this, consuming food without following the rules. Okay, we know Ashtavahar Vidhi Visheshayatanani. Okay, that is been taught. So, consuming for food, Prakriti, Karana, Sanyoga, Samskara, etc. are the Ahar Vidhi Visheshayatanani, wherein the food are not is not consumed according to whatever rules have been told. So, not understanding uh, the the properties of the food, the samskara. So two things which should not be sanyoga, which should not be brought together or consumed together, are consumed. So we know that honey and ghee, for example, should not be mixed in equal proportion because it can create a third entity which is not or which is harmful to the body. So, similarly, there are so many food items which should not be consumed together or mixed together and consumed. So, that is Prakriti Karana Sanyoga, Samskara. Samskara is something which should not be heated, or something which should not be fried, or something which should not be mixed with something, and some samskara on that is done. So, that is the food rules. If that is done on a regular basis, then the formation of dhatus does not happen properly. And if that is done on a regular basis, then the patient can end up into Vishamashana Janya Rajakshma. So how does it happen? Agni Mandya, Ama formation, Srotorod, improper dhatu formation, and dhatu kshaya. Okay, we will see the samprapti, but when it is Vishamashana Janya, Agni Mandya will happen, Ama formation will happen because the body is not in a capacity to digest that particular food item because it is not the natural way of consuming it, or it has gone into a transformation which it ideally should not go into and is consumed, will uh, lead to Agnimandya, Ama formation, Srutorod, etc. and the next stages of the Dhatu Kshaya. So when we see Samprapti, the disease pathogenesis, Hetu 7 happens first, exposure to the Hetu or the causative factor on a repetitive basis. It will lead to Vata Prakopa, aggravation of Vata. Pitta, Kapha and Pitta Prakopa also happens in this disease. So in order to take this disease to the next stage of formation, Vata Prakopa happens, Kapha Pitta Prakopa also happens with according to the hetus consumed. The Kapha and Pitta which are aggravated spread all over the body due to Vata. We know that पित्तं पंगु कफ पंगु पंगवमल धातवा वायुना यत्र नियन्ते तत्र गच्छन्ति मेघवत्. This verse we must have studied in the first year in the physiology. What does that mean? Anything which moves in the body moves with because of vata dosha. Vata is responsible for movement of any kind in the body. Okay, so pittam pangu kapha pangu, all the dhatus and the mala etc are pangu means paralyzed. Okay, so don't take the literal meaning of paralyzed. It is that they do not have any capacity to move on their own. So they move in the body only because of vata. So aggravated pitta and aggravated kapha move in the body or spread in the body because of vata, aggravated vata. And here the vata is actually more aggravated, so it will have more movement, more capacity to move than the natural vata. So because of pitta and kapha spreading all over the body, there will be blocking of or clogging of the channels of the srotas. So srotorod will happen, which will obstruct the movement, natural movement of vata, and then vata will start going haywire. So srotorod and agni will be seen. Because of agni mandya, two things will happen. Multiple symptoms will be seen on one side, and on the other hand, what is happening? Because of the Jathar Agni Mandya, there will be Agni Mandya at the Dhatu level also. So Dhatu Agni also is depleted. So on one side, when we see multiple symptoms because of Agni Mandya, excess of depletion of the Dhatu will lead to Rajakshma. Agni Mandya will lead to Dhatu Agni Mandya. Dhatu Agni Mandya again will result into incomplete formation or less formation of the rasa and the next dhatu, rasadi dhatu. And because of less formation, there will be certainly less quantitatively, qualitatively, functionally less dhatu in the body, which will lead to rajakshma. So here, when we see the entire pathogenesis, the samprapti, it starts from vata prakopa, and there is only depletion of the Jaఠaragni, of the Dhatu Agni, improper formation or less formation of the Dhatus, the quantity, quality, and functionality of the Dhatus decreases and goes it to a level where there is a formation of Rajakshma. Okay, so this disease formation will happen in this process in this way, and we'll see how the signs and symptoms of Rajakshma are. Now, with the till now whatever we have seen, you must have realized and understood that Rajakshma is not a easy to treat disease, or it is not a easy disease to even experience for the patient. When we understand that there is Agni Mandya also, Jatra Agni Mandya, Dhatu Agni Mandya, depletion of dhatus, aggravation of doshas. So all three doshas are involved, which are aggravated. All the seven dhatus are depleted. So understand the severity of the disease. Okay, so it is not as easy as the other diseases, which can be treated with minor corrections in the lifestyle and food habits and medicines, it is very difficult to treat disease, and the severity and intensity you can gauge by the elements which are involved in the process of the disease formation, right? So what are the Purva Rupa? We see that it is a big list of premonitory signs and symptoms. Why? Because again, as I said, the dhatus involved, all the seven dhatus are involved, all the three doshas are involved. So the number of signs and symptoms even in Purva Rupa and Rupa will be more. So in Purva Rupa, Pratishaya, sneezing, Praseka, Madhurasyata, body ache, Agni-mandya, nausea, vomiting, you can start relating the signs and symptoms to doshas and dhatus. Okay, so initial stages of depletion of the dhatus, we'll see certain things. Aggravation of all the three doshas will show these signs and symptoms. So pratishaya, sneezing, praseka will be vata and kapha. Madhurasyata will be kapha. Body ache, agni-mandya will be kapha and vata. Nausea, vomiting can be due to all the three doshas. Daurbalya is weakness. Okay, so here we start seeing the depletion of dhatus, weakness, daurbalya. Edema over the hands and face. Okay, that is shotha, over hands and face. Liking towards meat and alcohol. So we know in physiology, through physiology, we know that whatever is depleting in the body, we start having the body starts showing liking towards things which are opposite to it, which will nourish the things inside the body which have got depleted. So liking towards meat, because there is kshaya of Mamsa dhatu, liking towards meat will happen. When there is Agni Mandya, liking towards alcohol is there. Nidra will be excess because of weakness, of course, because of the Daurvalya, Nidra will be more, Agni Mandya, Nidra will be more, Kapha, Prakopa, Nidra will be more. Growth of nails and hair will be excess. Okay, the malas of nail and hair are the mala of Asti dhatu. Okay, so the growth of that will be more. Whatever more in the sense, it is not going to be prakruta growth, it is going to be vikruta growth. Okay, and uh, whatever asti dhatu uh, is present in the body, it will start getting consumed and going out of the body. Vata prakopa will lead to that. So excess growth of nails and hair. Now here also there is hair fall, which is seen in this type of patients. Rajekshma patients, it is not very common in our practice. We see Rajekshma. So till now we have seen, if I remember correctly, 2 patients we have seen of Rajekshma, which can be I don't like using labeled as Rajekshma. Okay, we can specifically say that okay, this was a patient of typical patient of Rajekshma. Dhatukshaya we see in all the patients, but if I have to count only Rajekshma, then we have seen 2 patients so far. What happened to them, we will see in the further slides. Impatient and inconsiderate behavior. Okay, impatient and inconsiderate behavior. This will happen because of depletion of what? Which dhatu?
That Rakta?
Question.
Rakta?
Rasa.
Rasa.
Rasa. So rasa dhatu is basically they're responsible for most of the behavioral things, the psychological things. Okay, rasa dhatu. If we when you study the dhatus, the kshaya of rasa dhatu, you try to recall the verse rase roksham shrama shrosho glani shabda asahishnutta. Okay, shabda asahishnutta means they are not in a capacity or in the state of listening to uh, words or sound. So they show this symptom of being impatient. So impatience in considerate behavior will be related to the rasa dhatu. Of course, when it goes to the rakta dhatu, next symptoms also will be seen. But majorly impatience is due to the rasa dhatu depletion of, and because we are looking at purva rupa, understand this also. We are looking at purva rupa. So in purva rupa, the first dhatu, the initial dhatu's depletion, signs and symptoms will be seen, right? In more Purva Rupa, Tridosha Prakopa will be seen. Imbalance at psychological level, as we saw that impatient behavior or inconsiderate behavior is seen. So the patient will start showing symptoms of getting angry on smaller things as well. Okay, so that will be inconsiderate behavior, and the patient will also start becoming aggressive. Aggression also will be seen because of the impatience. Mild and constant fever will be seen. Pitta prakopa is there. So mild and constant fever is there. Weird dreams. So this particular disease in the Purva Rupa, weird dreams is quite uh, typically properly mentioned in the classical textbooks, that the patient feels like uh, so majorly it will be more of vata and pitta related, movement related, aggression related, related to destruction, war, fire. So those kind of dreams, weird dreams, will be a part of Purva Rupa in Rajakshma. So when we do consultation, that time we ask the patient about their sleeping patterns, etc. In which the dreams, we ask the patient about dreams. So is there an inference interpretation which is based on dreams? We try to treat the disease? No, we just try to understand their their mindset. Dreams is nothing but what is going in their mind, is what they see when they sleep, or their expectations they see in the dreams, and uh, they tell you. So checking the asking about dreams, do you have dreams, or what type of dreams are there, do you recall them, it will give you some hint about their mind, mental frame, and also the extent of involvement of the dhatus also. Okay, so in this case, weird dreams majorly related to vata and pitta, more of movement, destruction, and uh, I should say larger than life. So it would be more like a, if they start telling you about their dreams, they will start telling you things which you will feel as if they are narrating you a story of some Bollywood movie, where they keep telling you so many things. Okay, so weird dreams is one of the Purva Rupa in Rajakshma. In Rupa stage now, according to we saw based on Rupa or the specific signs and symptoms, three Rupa. So three signs are seen in three Rupa Rajakshma. Now here, when we say that based on the number of signs and symptoms, it is three Rupa, Shad Rupa, Ekadasha Rupa. A few authors have given an explanation that more than they being types of Rajakshma, they should be considered as stages of Rajakshma. That initially it is three stage or three roop or three signs and symptoms. Then it moves to the next stage of Shadrupa. Then it goes to the next level of Ekadasha Rupa. So based on also the intensity of the disease, based on the number of signs and symptoms, the severity increases one, and the treatment becomes further more difficult. So you can imagine that a patient with just three signs and symptoms will be more easy to treat. Okay, so you may have a question that okay, if a patient comes with pain in the shoulder and lateral chest, burning sensation in the hands and feet, and jara comes to us, should that be treated as Rajakshma? See, I have said this in the past also. Acharya Charak says labeling of the disease is not important. If you are wise, experienced, knowledgeable, and uh, skilled enough with even these three signs and symptoms, you would understand that okay, the extent of involvement of doshas and dhatus has gone to a serious level and should be treated according to the line of treatment mentioned in Rajakshma. Uh, yes, you have completed uh, your process of understanding and treating. So every patient coming with jwara, fever, okay, we are going to learn fever, will have burning sensation in the hands and feet, will have pain in the shoulder and lateral chest region because body ache. But does that mean that that patient has come to you as three Rupa Rajakshma patient? Don't get into that. I personally feel whatever are the presenting signs and symptoms, you treat the patient according to that those signs and symptoms. You understand. Once you have examined the patient, then you realize that okay, in Puro Rupa stage, initial stage, the patient has certain signs and symptoms. Now, okay, I think it is going to Rajakshma level, should be treated accordingly. If the patient has come only with these three signs and symptoms without major Purvarupa, then treat the patient according to Jwara and settle the patient there. Okay. So when acharyas or classical textbooks say that okay, this is three Rupa stage of Rajakshma, you may not be able to understand that okay, this is three Rupa Rajakshma. You may consider that as patient with fever and treat. So it also means next, if a patient with these three signs and symptoms is not treated for not treated properly or stays without treatment for a longer duration will lead to or will get shifted to the next stage of Shadrup to Ekadashrup, and severe depletion of dhatus can happen, which will lead to Rajakshma in future. So now when we are studying Hetu, Purvarup, Rupa, Samprapti, etc., you know that okay, these things happen In Three-Row Prajakshma, these are the three signs and symptoms which are majorly seen. So this is Three-Row Prajakshma. But a patient comes to you and sits in front of you with fever. Will you start labeling the patient with Rajakshma? Oh, you have Three-Row Prajakshma. I think you are in a very serious condition and we should treat you very meticulously, properly. The patient will die half there itself. Okay. We are learning the theory to understand what is the process, how it happens, what is seen, and how it should be treated, what are the do's and don'ts to be told to the patient. So we are learning the process, we are gaining knowledge. How to utilize that knowledge is going to be your skill and experience as you move on. So things which I'm telling you come from some part, majorly come from the classical textbooks. Some part comes from my gurus and my mentors who have taught me, and some part which I have practically experienced through my practice. Okay, so labeling the disease is not very important. We have learned this many times. Of course, as a student, you should know the nomenclature and you should know what are the signs and specific signs and symptoms and Purorup, etc. In diseases. But practical application when it happens, labeling is not important. Okay. So a patient with pain with Three-Row Prajakshma will typically show pain in shoulder and lateral chest, burning sensation in hands and feet, and jwara. What happens in Shadrupa Rajakshma? Agnimandya. Okay. Bhakta Dvesha. Bhakta Dvesha means we have seen this word in the past. Food, uh, repelling food or disliking towards food. Bhakta Dvesha. Bhakta is food and Dvesha is disliking. So, disliking towards food is seen, which indicates Agnimandya. So, I'm not feeling hungry, or I don't feel like eating, or I feel hungry, but when food comes in front of me, I don't feel like eating, or if I eat some part, I feel okay, I'm done. So, that is indication of Agnimandya. Aruchi is seen, Jwara, fever is seen, Shwasa, Kasa, change in voice is seen. So, various involvement of various doshas and the dhatus as it moves to the next level, you will start seeing Agnimandya, Ruchi, Jwara, Shwasa, Kasa, change in voice. So, it is going to the next stages, Shadrup, Rajakshma. Then Ekadasharupa Rajakshma. Kasa, Jwara, change in voice, headache, vomitus with blood, involvement of the Rakta Dhatu, pain in the shoulder region, Aruchi, Shwasa, Atisara, pain in the lateral chest. So now here pain in the lateral chest, pain in the shoulder region. So this region, okay, this region is related to which organs? Heart, lungs. Okay, so kapha dosha, internally kapha dosha, and when there is aggravation, then of vata dosha, you will see pain in many parts of the body. However, because heart and lungs are majorly in the upper part of the body, sorry, as they are in the upper part of the body, you will see more symptoms related in the upper part of the body. Okay, so pain in the lateral chest, pain in the shoulder region indicate that there is involvement or vitiation of or affected organs are majorly lungs and heart. So it is causing problems to the heart functioning of the lungs. Hence, you can see pain in the lateral chest, pain in the shoulder region as the signs and symptoms in Ekadasha Rupa Rajakshma. So specific signs and symptoms of Vishamashana Janya and Vegavarodhaja Rajakshma. So in Vishamashana, Shula. So this can be Shula in any part of the body. A body ache, again the similar thing. Throat, pain in the throat, change in the voice. Pratishaya, running nose. Kasa, cough. Sputum with blood, that is Raktasthivana. And Daurbalya, which is weakness, that is due to Vishamashana Janya, that is in Vishamashana Janya Rajakshma. What happens in Vegavarodhaja? Pain in the abdomen, irregular bowel movements. Now here you can relate to what hetus we saw about holding natural urge of especially flatus, mutra and purusha, urine and stool. Pain in the abdomen, irregular bowel movements, pain in the chest and lateral chest, body ache, pain in the scapular region, headache, kasa, jwara, change in voice, pratishaya. Okay, so pratiloma gati, change in voice you will see majorly in Rajakshma there, uh, the Udana Vayu and the Prana Vayu, they both are affected. We saw in the first slide itself that we see uh, a lot of signs and symptoms related to Pranavaha Srotas. Hence, you can see change in voice as one of the typical signs and sign in symptom in the Rajakshma. In Rupa Sahasaja, internal trauma in the chest. So when we say internal trauma means it is caused from within. Okay, Urakshata, that is the uh, internal trauma to the chest because of extensive or excessive physical exercise beyond one's capacity. So here heart and lungs both have damage or they get affected due to ati sahasa. Headache, heaviness in the head, kasa, pain in the heart region, sputum with blood, daurbalya. Now sputum with blood, related to if you have come across or if you have seen people like lifting heavy weights. I came across one video which said something strongest man on earth or universe, planet or something. So those people were lifting heavy weights, intense heavy weights. So they were throwing it up 50 kg, 100 kg, etc. They were lifting 300, 400, 500 kg of weight. So which was beyond their own weight and beyond their physical capacity. And one of them, in fact, multiple of them I saw, when they lifted heavy weight, they kept on trying. They did not release the weight. They held it till they won the competition or they were adjudged winners, etc. Or in order to complete that session or that activity, they kept holding that weight and eventually I saw that blood was coming out of their nose and few were uh, spitting out blood, sputum with blood, ati sahasa. You can see these things. It's not only mentioned in the textbooks. You can see these things that doing something beyond one's physical capacity on a regular basis will lead to these things, sputum with blood, bleeding through nose, uh, bleeding through eyes may happen, but again that will be to the serious next stage. But sputum with blood, bleeding through nose will certainly be seen when there is excessive use of the strength. Excessive use beyond the capacity, I would say. Daurbalya, of course, because of the depletion of the dhatus. In Kshayaja, looseness in the joints, Shaithilya, Sandhi Shaithilya, looseness in joints, dryness in the body, Daurbalya, weakness, brittle bones, Asthi Saushirya is the Sanskrit word. Asthi Saushirya means the bones become brittle. So here you would see the bone density test will show depletion of calcium in the bones. So that indicates brittle bones. Asti dhatu is involved or is depleted, and dhatu kshaya is seen as the uh, as a sign or symptom in Kshayaja Rajakshma. Prognosis. Tri-roop to Shadroop to Ekadash Roop becomes more difficult to treat. We discussed that in the Rupa stage, in the Rupa slide. The Tri-roop would be uh, comparatively easy to treat. Shadroop will be bit more difficult. Ekadash will be most difficult to treat as it moves. So consider this as stages of the disease rather than types of Rajakshma, Tri-Roop, Rajakshma, Shadroop, or Ekadash Roop. So we can easily understand what the authors or the commentators are trying to say. So the next commentaries after, the interpretation of the senior acharyas and vaidyas, uh, through their experience also they realize that Tri-Roop, Shadroop, Ekadash Roop are stages rather than types of Rajakshma. So they become more and more difficult to treat as it moves along. When there is severe kasa, shwasa, sputum with blood, and atisara as complication, it makes it asadhya. Okay, severe kasa where the bouts of kasa or cough are constant, shwasa, severe breathlessness, sputum with blood. So um, they spit blood, and atisara. Atisara. So in Rajakshma, the depletion of the dhatus is uh, quite heavy in Rajakshma. So dharana dhatava. Correct. Dharana dhatava means what? Dhatus dharan or hold the body structure together. Okay, so the imagine frame of the body, it is held together by dhatus, because of dhatus. So we see the structure, bony structure, then you have muscles, then you have blood supply around, then you have rasa dhatu, etc. So it holds various systems in the body together, is dharana dhatavaha. That is the function of dhatus. What is the function? Dhatus will hold the body structures and systems together. So when there is severe depletion of dhatus, quantitatively, qualitatively, functionally, in Rajakshma, the mala, purisha, especially purisha, holding the purisha is one important part of the line of treatment. Why? Because uh, the purisha, when held in Rajakshma, means that you are holding bala of the patient. When the purisha goes out, when the patient passes stool, there will be severe weakness in the uh, in the patient, which will be seen. So this is seen in Rajakshma patient. that so one of the patients which we saw recently, he used to complain of uh, constipation. Okay, now that constipation also was happening because of the aggravation of vata dosha and depletion of the dhatus, uh, and there was dryness inside his body, but the body was trying to hold the purisha because it needed it to be there in the body. Why will the body want purisha in the body? Why will it not go out naturally? It is a waste product, it has to go out. But we know that when there is formation of, oh, okay, first is digestion, then is Sara Kitta Vibhajan, and Sara Bhag goes to the formation of dhatus, and Kitta Bhag goes to the Mala. It will go to Purisha, Sweda, and uh, Mutra. Now in Purisha also, as it moves to the next stages in the intestine, still some part of absorption will keep happening, and whatever still remaining nutrients are there in the last part, if it is there, if it stays in the body for any reason, if the purish stays in the body for any reason, the apyangsha, or the uh, whatever balance nutrient part and the fluid part is also absorbed by the body, because it needs it uh, for its functioning. Now it will need it more in Rajakshma because it is severely depleted. The dhatus have severely depleted, and for nourishment, whatever nutrient uh, part is there in the purish, that also will get absorbed. So in Rajakshma, virechana or purgation is ideally not done. If it naturally goes out, it is okay. But in that also, patient will experience a lot of weakness. Okay, Purish, the patient will experience a lot of weakness. So, as a part of line of treatment, uh, ideally purgation or anything which is laxative is not given. Okay, because the body is needing the nourishment, hence it is taking the nourishment even from the waste material. Okay, that is the need of the, I mean, that is the extent of need of nourishment of the body. So I was saying severe kasa, when there is severe shwasa, sputum with blood, and atisar. So when there is atisar, which means the body is now releasing whatever it has along with it, then it is an indication that the patient is becoming more and more serious and cannot be really treated with just medicine. Okay, even if and becomes asadhya, even if the number of symptoms is less, but there is severe emaciation and weakness makes it asadhya. Okay, here it means that even if it is 3 root or 2 symptoms or 5 symptoms, even if the number of symptoms of in the patient is less, but if there is severe emaciation, loss of mamsa dhatu is more and weakness is more, then it becomes asadhya. So a patient uh, who has sufficient amount of mamsa dhatu in order to hold the body frame and has some strength, physical strength and willpower also, will show better prognosis in terms of recovery. But patients in whom the muscle tissue is wasted, emaciation has happened, is experienced weakness. Even if the symptoms are less, the patient becomes incurable. Okay, so physical capacity, physical strength, because of strength in the muscles, and some strength in the body and the willpower will lead to better recovery, better prognosis. So in the last sentence you see, in young age patient without complications, Rajeshma is easy, fairly or comparatively easy to treat. Comparatively easy to treat. In this particular disease, there is depletion of uh, all the dhatus. We saw that. So when there is depletion of all the dhatus, it is not easy to treat at all. But if it is in young age with less complications, the patient has fair chances of recovery. Fair chances of recovery. This is we are seeing through the Ayurveda perspective of treatment of Rajeshma. Upadrav, lot of complications are there. Chest pain, body ache, excessive sputum, praseka, that is called in Sanskrit, Agni-mandya, halitosis, which is bad smell to the or bad breath, halitosis, shwasa, murcha, unconsciousness, convulsions, can be seen, scanty urine. Okay, we saw in Purisha that the body is trying to hold uh, the Purisha more for its nutrient. We can also see scanty urine because the body is trying to absorb whatever best it can. So hence there would be scanty urine as one of the complications. All symptoms can be considered as upadravas. So because of the severity of the disease, uh, I mean the intensity is so much that whatever signs and symptoms are seen, they themselves can be considered as upadravas is what the acharyas say. Now coming to treatment, Vamana, Virechana, Bruhana, chicken soup. Okay, let us start with Vamana first. Now we have seen this in the past as well. Whenever we have to do Shodhana Upakrama, Shodhana is the cleansing process, Panchakarma, especially Vamana Virechana. When we have to do Shodhana, the strength of the patient has to be sufficient and adequate in order to bear whatever physical strain it takes to undergo this process of cleansing or Shodhana. Okay, so Vamana Virechana can be given if provided the strength of the patient is adequate in order to bear the physical strain. So Vamana will be given when there is excess of uh, kapha symptoms seen in the chest region. Okay, that time Vamana can be administered. Virechana should be given very thoughtfully, uh, very mindfully, and considering the strength of the patient first. And even if Virechana is given, it has to be mild laxative, mild Virechana only. Strong Virechana, the patient is, the ultimate thing will happen to the patient. Uh, but if the strength of the patient is okay, and if the patient is experiencing constipation, then you can give mild Virechana, mild only. After once you have understood that the strength of the patient is okay in order to bear the physical strain. Bruhana is what? Nourishing treatment. Okay, so nourishing food items and nourishing medicines. Okay, especially ghees and oils and milk. All those things are Bruhana, which Bruhana is nourishing to all the dhatus, that is bruhana. So when you say it is nourishing or bruhana items are to be given, they have to be mindfully given. Why? Why bruhana is to be done mindfully, or
Because
food
of
items?
the mental state of the patient,
Because of
the mental state of the patient.
not really the mental state. It is because of Agni Mandya. Bruhana is nourishing. Okay, so Bruhana would be uh, at times heavy to digest. Okay, so Bruhana, if not given when the Agni is proper, will cause ama. Okay, so any Bruhana treatment, when given, you have to start with lesser quantity, with smaller quantity, understand how the patient is responding, how it is getting digested, and then go to or then start increasing the quantity. So Bruhana Chikitsa is nourishing to all the dhatus. However, we have to check the Jathar Agni, the Dhatu Agni, see the effect of that particular uh, food item or medicine, and then accordingly increase the quantity. So, Bruhana, in order to have good action of Bruhana on the body, the strength of the digestifier, the Jathar Agni and the Dhatu Agni, has to be uh, optimum or sufficient in order to digest that particular item. Chicken soup is even if the patient is vegetarian or uh, so here vegetarian we refer, very less people would be vegan here, vegans here, but vegetarian. So if the patient is very strictly vegetarian and does not so the last patient which we saw for Rajakshma, uh, he was a strict vegetarian all his life. Even to an extent, he used to say that do not give me any medicine which contains anything which is non-vegetarian, any ingredient also. So even if I mean many medicines will have ingredients which are animal based, uh, so or meat or even uh, their fat, etc., is used. Kukut andatvak, suppose. So the shell of the egg of uh, the chicken also is considered non-vegetarian. Uh, However, if it is required, in this case, uh, you can hide this from the patient and give the medicine. Give it as a medicine because you are doing it for the benefit of the patient. So we had to do this with that patient as well. That give that as something else or soup of something else. So add dal to it or add some vegetable to it, etc., and then make it uh, such that the taste of it is not felt. However, the patient did realize that something different is being given, so he did denied consuming that. But uh, as 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 a practitioner, so this was the case of our patient. But if you find a patient who is vegetarian and does not eat non-vegetarian stuff, we have to hide this with the patient and uh, take the relatives of the patient in confidence and uh, tell them that this is for the benefit of the patient and hence we are doing it. And chicken soup, which is one of the best things to consume for this in Rajeshma, should be administered. So start again with chicken soup, start with smaller quantities, understand how the patient is responding, how is the patient able to digest it properly. If it is an all eating patient, I mean, also consumes non-vegetarian, then it is easy. Start with lesser quantities, give it warm, and then increase the levels. So, in the past also, as students, we used to see that uh, patient who are given chicken soup, they recover very fast. Their recovery is faster because it gives nourishment to all the tissues, especially rasavaha and mamsavaha. So the strength building happens faster. They start responding to the medicines faster. Their confidence boosting happens faster. So fermented asava arishta are to be given in order to ignite the uh, the Jatharagni. Okay, these are fermented, so self-generated alcohol is there. So medicinal fermented liquids or medicinal wines is what how they call it. So for fermented asava arishta, especially drakshasava or draksharishta, it works wonderful in these patients, and it will help in uh, removing the clogged pores, the channels, not pores, the channels, clogged channels. Srotorod it helps to reduce Srotorod and also improve the digestive fire and reduce Agni-mandya. Okay, so in patients, otherwise also when we see Agni-mandya as one of the strong symptoms, we give asavarishtas. In this case, Drakshasava or Draksharishtas, but otherwise there are so many asavarishtas, I'm sure you are aware. Those are planned in the treatment in order to improve the Agni. And our experience has been most of the patients have uh, armor, presence of armor in their body to from smaller to larger extent. Almost all, almost all. It is very difficult to find a patient uh, who is Niram. So some present, it may show up in their signs and symptoms or may not, but presence of armor is there because of the lifestyle which people are going through nowadays. Eating habits, sleeping habits, exercise, etc. is not proper. Hence, lesser to larger extent of armor is seen in all the patients. So hence, initially we have to do Dipana, Pachana, Langana. Not many patients are okay with Langana, but Dipana, Pachana. So we have to manage that with medicine. So Asava Arishtas help tremendously in that. So people who are not willing to do Langana or they are not in their profession doesn't allow them to stay hungry. So in that case, we have to give asavarishtas in order to improve their agni and digest ama. Not holding the natural urges uh, is uh, is one of the pathyakar things which should be told to the patient. Not holding the natural urges. In Shamana Chikitsa, Srotorod, reducing and improving Dhatu Agni treatment uh, is the line of treatment. Okay, so Srotorod, removing the clogged channels, improving the Jatharagni, in turn, which will improve the Dhatu Agni also. Medicines are planned accordingly. So, what are the medicines which can be given? Suvarna Malini Vasanta. Okay, so Vasanta Kalpa is what it is called. So Suvarna Malini Vasanta, Madhu Malini Vasanta, these items, these medicines, they have Suvarna Basma, Raupya Basma, Silver Basma, Gold Basma, Pearl Basma in that, in them, or even Coral Basma is there. So they help because Basmas are very fine. You know what is a Basma. So because it is fine, it gets absorbed faster, digested, absorbed faster, and its action can happen faster than the uh, herbs only medicine. Okay, hence the planning or inclusion of gold, silver, or the bhasmas in treating Rajakshma, or where there is severe depletion of Agni, will help better. Okay, Abraka Bhasma helps. Abraka Bhasma is very good for the respiratory tract. We all know. So Abraka Bhasma, Gold Bhasma, Silver Bhasma, Coral Bhasma, Praval Bhasma. So Praval Panchamrut is good, uh, which is available there. And I'm saying. Then Shatavari in all forms, Shatavari is good as a nourishing herb. So Shatavari Churna, Shatavari Kalpa is good as a nourishment to Rasa and Maunsoha Srotas Maunsoha Dhatu, sorry, Maunsa Dhatu and Rasa Dhatu. Yashti Madhu, licorice is good. Ashwagandha is good for nourishing all the dhatus, especially the Shukra Dhatu. Bala, Sida cordifolia is good as a nourishment. Vasanta Kusumakar again is a preparation which has gold bhasma in it. Vasavaleha. So Vasa is Adathoda vasica, one of the herbs. So a marmalade prepared out of Vasa is good for the respiratory tract. Okay, Vasa is very good for respiratory tract. So a patient who has anything or any disease related to respiratory system can be given Vasavaleha as first as treatment and second as Rasayana, build immunity and strength of that particular system. Vasavaleha, particular system means respiratory system in this case. So any other patient also who is suffering from respiratory problems, and if you have to increase the immunity of that patient, Vasavaleha can be given as first as treatment and second as Rasayana. Okay, building immunity of the respiratory system. Vasavaleha.
Excuse me, Dr.
Snehan. Ah,
Swapnil, can I, it's Sonia here. Can I ask a question, please?
yes, Sonia.
What about Hirak Basma?
Of
Hirak Basma. Hirak.
Hirak, yes, I understand. Hirak Bhasma is also good, and you will see that as an ingredient in one of the uh, the medicines. So in the preparation, so Hirak Bhasma basically will be good. However, because of the cost factor also, uh, if the patient is affording, then uh, we can administer that. And when it is needed and the patient is affording, we do use Hirak Bhasma also. However, there is limitation to using Hirak Bhasma because of its cost factor, nothing else. But it is good. It is very
Okay.
good.
Thank you.
Okay.
Yeah, I understood it to be sort of the Rolls Royce of the medicines, like very, very effective. But yeah, the cost up there.
Exactly. So Yes, the cost factor is there because not all the patients would be affording, and they may not be. So once you tell them the cost, they may uh, not be willing to take. So we can start with the basic things first, and if required, we can explain them and give them in smaller doses if Hirak Basma is available with you.
Thank you.
So yeah, so Snehan, Bala for internal, external Snehan, Bala oil, Chandan Bala Lakshadi oil can be given. So external Snehana will help uh, giving strength to the tissues, one, and more importantly, pacifying Vata. So Snehana in all forms will will help the patient. Okay, so especially Abhyanga will be very good. Abhyanga, it has multiple benefits, which I'm sure you must have studied. So in Rajekshma patients or even in emaciation, Karsha, Abhyanga works very well. Okay, so Bala oil can be used, Chandan Bala Lakshadi oil can be used. Avagaha Sweda, so Avagaha Sweda is nothing but sitting in like it's like a tub bath. So in a tub you have even warm water is okay. If you can prepare decoctions and ask the patient to sit in it, Avagaha Sweda works very well after Snehana. So Avagaha Sweda, again, if Snehana is done and Udvartana, mild Udvartana is done, then it will help in reducing the Srotorodh. So here, mild Udvartan is only to reduce the Srotorodh, nothing else. Okay, we have studied when we studied Udvartana, we studied that it will help in reducing fat and cellulite and etc in weight reduction. But here the property of removing the clogged channels is used. So hence mild Udvartana is done. Before that, so Snehana is done, Avagaha Svedana is done, again Snehana is done, and then mild Udvartana is done, so that there is no aggravation of Vata. Okay. Patients, Rajakshma patients are very sensitive to anything positive or negative. Okay, so in order to get the best results out of your treatment, be it food, be it medicine, be it external, internal treatment, right medicine, choice of right medicine uh, helps in getting better results. Okay. Bruhana Basti, Anuvasan. So Bruhana is basically which will settle the aggravated vata and also nourish the tissues. So in Bruhana Basti, Anuvasan Basti will be helpful. Goat milk, sorry, in here this is quite interesting and different uh, treatment which is mentioned in the classical textbooks. It is quite surprising also because so I'll just explain you the treatment first. So what does it say? That goat meat should be consumed, goat milk should be consumed, goat ghee, okay, should be consumed, and the patient should stay in the goat shelter. Okay, so here Rajakshma patients where there is the goats are kept in that shelter, the patient is uh, uh, is told to live in that and consume whatever comes from the goat, so meat or milk or ghee from the goat. So where he stays, even that room, that hut should be uh, a lepana the of the feces of the goat should be used for lepana of the floor and the walls, is what is told in the classical textbooks, and it helps to heal the Rajeshma faster. Now the reason for this, uh, only now that the medical science knows that goat does not get tuberculosis. The goat is not affected with tuberculosis. Now, why it is surprising when it is mentioned in the textbooks, and it was written when we did not have any such uh, advancements in science, which where we could detect that this particular thing does not happen to goat. That time it was written that uh, the patient with Rajeshma should be asked to stay in the goat shelter and consume whatever comes out of the goat. So naturally, the goat must be having those that immunity and resistance power uh, against Rajeshma or tuberculosis. Hence, the Acharya said, uh, consume everything coming from the goat and stay with the goat so that the immunity will build faster and the Rajakshma will get cured faster. It is so surprising and it is very amazing, because the more I have kept seeing this, the observation, the experiences, the study, uh, the practicals they did without having any modern tools with them is amazing. Even the anatomy and physiology, the way it is mentioned in the textbooks, it is amazing to know without any modern tools and technology, they could write so much. They had that skill and knowledge. So it is really it is an amazing science. The more you read in detail, the more you get surprised every day. Every day mean the more you read, the more interpretations you will find, new meanings of those words you will find. You know that Sanskrit words, the meaning, it has multiple meanings. The same word will have multiple meanings according to the context. So the more you read, the more you will be able to have additional dots in connection. So connecting the dots is one thing, but having additional dots in those connections will happen only when you read more, practice more. Okay, so it is really uh, uh, it is a happy moment for me to explain this about the goat treatment, which is very different than any other treatment which we have studied till date. So staying in the shelter of the goat, eating goat meat, then the soup made of that meat, milk and ghee which is coming out of that, the butter which comes out, of course, goat milk. The butter is very less, but that also will help in healing Rajashma faster. For Kasa, Sitopaladi Churna, Vasavaleha, Pippali, long pepper, uh, Abrakabhasma, and they are helpful. In treating sputum with blood, Vasavaleha helps. Kamdudharas, so Kamdudha with Sadha or with Mautik, both are good. If there is Daha also, Daha is burning sensation, then Kamdudha Muktik Yukta with Pearl Bhasma will be good. Chandrakalaras is good for sputum with blood, which is, it is cooling in nature. It will pacify pitta faster, more efficiently. For Atisara treatment, Suvarna Parpati, Kutaja Parpati, Parpati Kalpana preparations uh, of Suvarna and Kutaja. which can be used for Atisara. To treat Jwara, Daha, Trushna, Pitta symptoms, Guduchi is Tinospora cordifolia is the drug of choice for treating Jwara, Daha, Trushna. So Guduchi, what are the multiple preparations of Guduchi are there? Sanchamani Vati is there, Amruta Gokul is there. So anything which has Amruta, even only Amruta Churna, Guduchi Sattva is there. So only Churna of Guduchi also will help a lot. Decoction made of Guduchi Churna will be easier to digest for the patient. For Rasayana, Chavanprasha Valeha, Ashwagandha Valeha, they will be good as a Rasayana. So Rasayana for all the, it will improve and nourish. So it will improve the Agni, Dhatu Agni, and also nourish the all the dhatus. Chavanprasha. Okay, so Chavanprasha, when consumed in controlled quantities and in Rasayan Kal, which is empty stomach in the early morning, will certainly do Rasayana to all the, will act as Rasayana to all the tissues. Ashwagandha Leha also is a very good preparation. Chavanprash is more easily available. So Chavanprash can be administered for all the patients of respiratory problems. If Vasavaleha is not available, Chavanprashavaleha can be given for respiratory tract problems. In Rajekshma, Chavanprash will act better. So what is Pathya? Old rice, wheat, milk, ghee. Now here cow milk, cow ghee also is good, but if you can manage, if you can get goat milk, goat ghee will be more better. Meat soup, so meat coming out of the desert animals will be good, easy to digest. Goat milk, goat butter, goat ghee, we already discussed. Madhura rasa should be given once the digestive fire is better. Then Madhura rasa can be given as it is nourishing. Draksha, so even grapes are good, even raisins, both are good. Coconut water, coconut pulp, both will be good for Rasavaha Srotas and Maunsavaha Srotas. Why I'm saying Srotas? Rasa Dhatu and Maunsa Dhatu. Pomegranate is good. Mango, nourishing. Almonds are nourishing. Walnuts are nourishing. Happy and cheerful conditions. So, the mental state of these patients is disturbed. So, happy and cheerful conditions around will help the patient to recover faster. Now, this is true with any psychological disorder or any severe disease. More so in Rajekshma, happy and cheerful environment around will help the patient to boost their morale and will help to recover faster. Abstinence from sex, yes. So Shukra Dhatu will be okay for with sex. One in Rajeshma especially, sex is one will be the physical activity, so the strength will be reduced after this the physical activity, and also the Shukra Dhatu which goes out will further deplete the Shukra Dhatu and strength of the patient. So abstinence from sex one, and physical activity, any kind of physical activity like exercise should be avoided. Rest will be a must. So retaining the strength, retaining the energy will be more beneficial. Apathya, eggplant, bitter gourd, bitter taste food, guru, abhishandi ahar, Abhishandi is something which, when goes in the body, will increase the secretions and can uh, cause srotorod or clog the channels. Is Abhishandi Ahar. Indulgence in sex is apatya. Exercise is apatya. We saw daytime sleep can cause srotorod, so should be avoided. When we say rest, so if the patient has to sleep in the daytime, you can tell the patient to sit in the chair and sleep or rest. Anger should be avoided. So things which, apart from the list, things which will aggravate the doshas, because we know that all the three doshas are involved here. So dosha aggravating factors should be avoided. So patient has to be quite careful about whatever they eat and whatever they do during the treatment phase. And you also have to be more meticulous in informing the patient about their do's and don'ts properly. So the list may be quite lengthy. However, that is going to be for their benefit only. Okay. The uh, the occurrence of this these type of patients will be comparatively less. However, because it is in our curriculum, we have to study, and it is a very good disease to know, because it involves all the dhatus. So um, it is difficult to treat and challenging. So if you get to come across Rajekshma patient, it will be a good practice challenge for you. Okay. Now, considering the modern medicine, tuberculosis uh, as a correlation disease, taking care of your personal care by using mask and gloves, etc. That should be done. So whenever you have respiratory concern or patients with respiratory problems, you certainly should use gloves and mask while you do the consultations. And you do, because why do we use gloves? Because you are going to do sparshana pariksha also. Okay, there will be limitations to understand the temperature, etc., but that can be managed with thermometer as well. Okay, your care is equally important as the care of the patient as well. Okay, fair. I think with this we are done with Rajakshma. If any questions you may ask, else we are good to take a break.
Yes, Dr. Swapnil, I have a question.
Yes, please go ahead.
So I hear that, they're trying to eradicate TB and that there is TB around the world. My grandfather died of it. When I was a child at school, we all had to have tests, and I came up positive, and I had to have x-rays every year. My mother came up positive, so she must have had an immunity from her father. He died before I was born, so maybe that, I don't know, that was passed on. And I know that TB can stay in the body for decades. So if they don't, they stop testing every year at school. So I don't know, the procedure must have changed, or there was less TB in the community or something. But yeah, so if people have been tested for it, would you just give them rasayana to prevent, like they say that, well, Western medicine says it can stay in the body for decades. So would you just give them a rasayana to prevent it, or?
Yes, good question. See, Rajakshma, once you have completed the treatment, in the classical textbooks, one of the commentaries we read that once you are once you feel that the patient is treated of Rajakshma, and the patient, if does not show any signs and symptoms, relapse of any signs and symptoms for 1000 days, then you consider that the patient is cured completely. So this is from the classical textbooks. The one of the commentaries, I mean, the classical textbook says that there is always a chance of relapse of Rajeshma if the patient, and that is true with every other disease, but more so with Rajeshma, that it can relapse very fast. Hence, Rasayana is important in Rajeshma. Now, coming to your question about giving Rasayana to patients who have tested positive in the past, can be done. If the patient is willing to take the Rasayana for a longer duration, we can certainly give. However, since we have the medical advancements uh, at hand, the test can be done in order to just ensure that it has not come back. So if the patient is willing to take Rasayana, we should be more than happy to give it. And Chawanprash is something which can be consumed for the life by any healthy person as well. It will help more and better in Rajeshma as a Rasayana, no doubts. So, if you have a patient who has given an history of Rajeshma or TB in the past, you can certainly get a test done, tuberculin test done, fresh test done, so that we know if it is active or in the dormant stage. If it is negative, then we can consider it to be in the dormant stage and it can come back. As you said, it can come back anytime. So, precautions, we cannot tell them, okay, this is apatya, this is pathya, etc. But we can certainly give them rasayana treatment if they are willing to take for long term. Okay, so Rasayana will certainly help.
Thank you. One question about the Rasayana. My understanding with Rasayana is you take it first thing in the morning, empty stomach, a Chyawanprash. But I also understood that to take Chyawanprash after lunch specifically to target the respiratory system. Is that correct?
I have not come across any. No, I have not come across any such thing before. And because Chyawanprash is, this is my point of view. It may differ from the other acharyas, I would say, or the other treating doctors. Chyawanprash is heavy to digest. Okay, and unless it is digested properly, it will not show any digestive any rasayana effect on the body. Okay, so hence I personally always tell the patient to take it early morning, empty stomach, and until the time they feel the taste of Chyawanprash or the burps of Chyawanprash, do not eat anything. If they are not able to understand, sorry, I'll just complete. If they are not able to understand that if the Chyawanprash is digested or not, just keep 60 to 90 minutes of break after you have consumed Chyawanprash, 60 to 90 minutes of break, and then they can consume anything they want later. Yeah.
Sorry, the last question. So I had somebody tell me that they had difficulty with Chyawanprash. I found it too heating. The system was high pitta. I have heard that I know that it's Viruddha Ahar to have cow's milk, but I was told they probably people might be better off having a bit of milk with the Chyawanprash if they find it too heating. What do you think?
Classical textbooks, if you read, milk is told as Anupana to Chyawanprash. So Chyawanprash should be consumed with milk, ideally, is what the classical textbooks say. So if they have burning sensation or they are high on pitta, you can certainly tell them to consume it with milk.
Oh, thank you. That's fantastic.
Yeah. Here, only thing you have to consider also, apart from this condition, is their digestive fire, if it is strong enough to digest milk and Chyawanprash both. Okay.
Okay, thank you.
Okay. Yeah.
I've just got a question as well. What
Mhm.
dose would you give of Chyawanprash as a Rasayana to an adult?
5 grams. Start with 5 grams first.
Okay, and how about a
Okay.
child?
Child, what age?
Say like 10-year-old, 11-year-old?
Beyond 8 years, you can give start from 5 grams also.
Okay.
Okay. And for adults, we can increase it up to 10 grams.
Thank you.
Yeah. Okay. We're done.
Yes, thank
Thank
you.
you.
Okay.